your doctor just prescribed gabapentin. But here is the question nobody asks out loud. Does the dose actually matter that much? Is 100 mg really that different from 300 mg? Or is it just a bigger number on the same pill bottle? The answer might surprise you, because the difference between these two doses is not just about strength. It is about how your body reacts, what side effects appear, and whether the medicine is actually working the way it should. In this video, we are going to break down exactly what changes when you move from 100 mg to 300 mg of gabapentin. We will look at how the drug behaves at each dose, which side effects become stronger, and what signs tell you a dose might be too high or too low. Most importantly, we will talk about something doctors do not always explain clearly: why gabapentin dosing is not the same for every person, and why the right dose for one patient can be completely wrong for another. Before we compare the doses, let us quickly understand what gabapentin actually is. Gabapentin is a prescription medicine used mainly for nerve pain and certain types of seizures. It works by calming overactive nerve signals in the brain and nervous system. When nerves send too many pain signals or fire too irregularly, gabapentin helps slow that activity down. It is commonly prescribed for conditions like diabetic nerve pain, post-surgical nerve pain, shingles pain, and restless leg syndrome. Some doctors also use it for anxiety and sleep in certain situations. It comes in different strengths, and 100 mg and 300 mg are among the most commonly prescribed starting doses. Gabapentin does not work like a typical painkiller. It does not block pain the way ibuprofen or paracetamol does. Instead, it targets specific channels in nerve cells that control how electrical signals move through the nervous system. By reducing that overactivity, it can calm nerve pain, reduce seizure frequency, and, in some people, create a feeling of relaxation or sedation. This is important to understand before comparing doses, because the more gabapentin you take, the stronger these effects become, both the helpful ones and the unwanted ones. 100 mg is usually where doctors start. It is considered a low introductory dose. At this level, the medicine begins to interact with nerve channels, but the effect is generally mild. Many patients at 100 mg report feeling slightly calmer, mild reduction in nerve tingling or burning, and in some cases, a little drowsiness, especially at night. Side effects at 100 mg tend to be manageable. Dizziness may appear, but is usually mild. Drowsiness is common, but often improves after a few days. Some people feel almost nothing at 100 mg, especially if their nerve pain is moderate to severe. That is normal. 100 mg is often a test dose to see how the body tolerates the medicine before increasing. At 300 mg, the effects become more noticeable. This is often the dose where patients begin to feel actual pain relief. The nerve calming effect becomes stronger. Many people at 300 mg report significant reduction in burning or shooting nerve pain, improved sleep because pain disrupts sleep less, and sometimes a feeling of mental heaviness or brain fog. But the side effects also become more noticeable at this level. Dizziness can be stronger. Drowsiness may interfere with daily activities. Some people feel unsteady on their feet. Memory and concentration can feel slightly slower. These effects are more pronounced at 300 mg compared to 100 mg, and they vary significantly between individuals. Let us put the comparison together clearly. At 100 mg, pain relief is mild to moderate, side effects are usually minimal, body is adjusting to the medicine, and it is mainly used as a starting point. At 300 mg, pain relief becomes more significant, side effects become stronger, especially sedation and dizziness, cognitive effects like brain fog may appear, and the medicine is now working more actively on nerve channels. The jump from 100 mg to 300 mg is not just 3 times the dose in numbers, it is a meaningful step up in how the medicine affects the entire nervous system. That is why doctors usually increase doses gradually and carefully. Not everyone moves to 300 mg. Some patients stay at 100 mg for good reasons. Elderly patients often stay at lower doses because their bodies process medicines more slowly. People with kidney problems may need lower doses because gabapentin is cleared through the kidneys. Patients who are very sensitive to medicines or who experience strong side effects at 100 mg may not tolerate 300 mg well. On the other hand, patients with moderate to severe nerve pain who do not get enough relief at 100 mg are often moved to 300 mg or higher. The decision is always based on individual response, medical history, and how well the body handles the medicine. This is where serious risks begin. Some people assume that if 100 mg helps a little, then taking extra will help more. This kind of thinking is dangerous with gabapentin. At higher doses, especially doses taken without medical supervision, the risk of severe drowsiness increases significantly. Breathing can become affected, especially when combined with other medicines. Coordination problems can lead to falls and injuries, and dependence can develop faster than most people expect. Gabapentin misuse has become a growing concern in many countries. It is not a harmless medicine just because it is not a traditional opioid. Taking more than prescribed is never safe. Another important point is what happens when gabapentin is stopped. Whether you are on 100 mg or 300 mg, stopping suddenly is not recommended. At 100 mg, withdrawal effects are usually mild because the dose is low. At 300 mg, stopping suddenly can cause anxiety, restlessness, sweating, trouble sleeping, and in some cases, increased seizure risk in people already prone to seizures. This is why doctors always recommend tapering, reducing the dose gradually instead of stopping all at once. The higher the dose and the longer it was used, the more carefully the reduction needs to be managed. So what is the real difference between gabapentin 100 mg and 300 mg? It is not just about strength. It is about how deeply the medicine affects your nervous system, how your body responds, and how carefully the dose is managed. 100 mg is a starting point. 300 mg is where real effects, both good and difficult, begin to show more clearly. Neither dose is automatically safe or dangerous. The danger comes from misuse, combining with other substances, or stopping without medical guidance. If you are taking gabapentin at any dose, always follow your doctor's instructions carefully. And if you feel something is wrong, speak to your healthcare provider before making any changes on your own. If this video helped you understand gabapentin better, please like and subscribe for more medical awareness content. Drop your questions in the comments below. We read every single one. Stay informed. Stay safe.